Hi everyone, and welcome to our next panel, which I have to say I am very excited about. We have a panel around in dialogue with healthcare's new entrants. And by healthcare's new entrants, I mean Magic Leap, we have Twitter Client Solutions, and we have Lululemon. And I have been reliably informed by Tom Waller, the SVP of Advanced Innovation, that it is Lululemon, not Lululemon, as I have apparently been pronouncing it incorrectly for all this time. So we have John Hodgson, who is moderating. As always, if you want to ask any questions during the panel, please do so in the box on the platform. We'll obviously get to those if we can, and I'll make sure that they're answered, even if it is after the session. So without further ado, over to you, John, and enjoy the session.
Thanks, Becky, and welcome everybody to this session. The panel is called In Dialogue with Healthcare's New Entrants. Well, we'll see to what extent there are going to be new entrants, and we'll see to what extent Fortress Healthcare will remain as it's always been. But I suspect that there'll be some mind-changing views expressed on this panel, and I'm looking forward to hearing them in extensio. So first of all, I wanted to check in with our panelists to see, while they're still outside healthcare, what they see as the opportunity in healthcare and what the specific opportunity is for the companies that they're working with. So if I can start with you, Lisa, everyone will have heard of Twitter, of course. Their involvement in healthcare may be a little more discreet. So can you tell us a little about that and what you see as the possibilities?
Sure.
Briefly.
Sure. Well, thanks for having me. So I lead the healthcare vertical at Twitter, and I think I've been in healthcare now for just over 10 years. And really, the past 5 years has been an amazing transformation. And I think social has really led that, because your health, and if you had a condition, all of that was always very private, and you kept it to yourself, and you talked to you and the doctor, and that was it. And social has really opened up that in a massive way, and patients are sharing their stories, they're finding each other, they're finding support. But what's interesting also about Twitter is that we're a huge platform for HCPs and how they're finding each other and they're sharing information. And I think social has really changed the whole dialogue between patients with their healthcare providers, with each other. And Twitter has really been a huge part of that. And it's really, really exciting.
Jennifer, if I can quickly turn to you and get the view from a company that perhaps few of us have heard of, Magic Leap. So you're into virtual reality. Tell us about the interface with existing healthcare.
Yeah, thanks very much. Yeah, John, I'm Jennifer Esposito. I do lead the health team here at Magic Leap. Magic Leap is what we call a spatial computing company. So, as opposed to VR, which is completely immersive and you're unable to see the real world, with spatial computing, it's really the ability to merge both the physical and the digital world and to be able to interact between the two. And so, we see a large number of use cases across the entire spectrum of both, health, wellness, and fitness. We've spent a lot of time as an organization, probably going back even prior to the launch of our first product, actually focusing in on healthcare as one of the priority industries for the company. And, as I said, that's because we really do fundamentally believe that there's an opportunity here to both improve care and really think about really new ways to enable both clinical workers and patients to engage with their care and to, in a lot of ways, experience a more amplified or augmented experience around their healthcare. So, I'm really excited about the conversation here today because I think there's so much that we could potentially talk about. Looking forward to the rest of the conversation.
And so finally, Tom Waller, you're at Lululemon. Tell us about what the company does and how you interface, how you're looking at the current healthcare setup and from the outside at the moment.
Thanks, John. I appreciate the opportunity to share a little bit. I mean, Lululemon at face value is an apparel retail company. Yet at our core, what we are really about is mobilizing a community around healthy human potential. And that was the sort of the founding spirit of our company. And in my capacity as the Chief Science Officer, part of my remit, my team's desire is to understand the mechanisms of healthy human potential. And in that work, as we even think about the role of people being able to live into or follow a brand, which they wear literally on their bodies, we've started to identify the secrets of positive behavior change. And so as it relates to our direct engagement with healthcare, we're provocateurs at a distance and co-conspirers behind closed doors as we work with increasing numbers of healthcare entities to support them in understanding positive behavior and using some of the culture that we've created from a brand point of view that can impact that human potential outcome that we would like to see.
Tom, I'll come back to you on how some of that brand influencing works, but can I ask you, Jennifer, about some of the practical applications or some of the working applications that you currently have at Magic Leap?
Yeah,
that
absolutely.
are relevant to healthcare, obviously.
Yeah, of course. No, like I said earlier, there are a lot of use cases. We have focused our efforts, over the last, probably 18 months on the operating room and surgery. And so some of the early use cases that you're seeing in this space, well, partially training, it can be things like surgical planning. So for example, a surgeon being able to take their traditionally 2D radiology images and being able to see them now in 3D and being able to collaborate with either their colleagues, other doctors from other locations, but also being able to use that as a way to educate patients and their families. So having a patient put on our headset and being able to experience in 3D their anatomy and understand the surgical approach that's going to happen, understand some of the risks and the complication potential. So it's really a way of taking, flat images that were obviously very hard for people to understand without a lot of great training, and making it much more accessible for everyone, for both from the surgeon perspective, who isn't necessarily a radiologist, and also from the patient and their family's perspective. So that's one core, early use case that's already seen a lot of traction. And then that will continue to expand to different use cases that actually would occur in the operating room itself. So being able to display additional 3D information for surgeons, being able to understand some of the movement and objects and the workflow that's going on. So surgery is definitely a very important area of focus for us.
So it's going into an additional dimension, but it's also it's shareable,
yes.
Concurrently shareable is the point. You don't have to, you can debate about what you're all seeing at the same time.
Exactly. I mean, you're essentially being able to collaborate in 3D, which means, you can certainly make these images, as big as you want. You can all kind of see the model from the same vantage point. So you all know you're looking at the same thing. And you can pull away layers, you can add layers. And I think it really does bring, a whole nother level of insights. The other area that we're doing a lot of work in right now, and where we have a very active partner ecosystem, is what I would describe as sort of the health tech or fit tech area, where these are scenarios where either a patient or a healthy patient or a consumer is able to use the device for a variety of different use cases. Some of it could be things like delivering virtual therapies of different kinds. Certainly using the device and that collaborative functionality with 3D capabilities.
What do you mean by virtual therapies, by the way?
Well, virtual therapies can be a lot of different things. I mean, the one that we've seen a lot of activity on, we actually have a partner who has been building a virtual physical therapy application. And so they're using the device to both track the motion of the patient and be able to display to the patient how they can correctly do different exercises, and then understand once they perform the exercise how well they did it, right? So they can kind of give them a more dynamic and real-time feedback loop. So that's just one example, but if you could kind of imagine the fact that you're able to in real time give patients more feedback about what they're doing. looking at some of the movement metrics that we can capture as people are wearing the device, and presenting it to patients and the, you know, maybe even potentially the provider on the other end in a different way.
So Tom, for Lululemon, do you have that same kind of interface with? I mean, I can see from Jennifer's description that there's a new kind of information coming out of their systems, and it's going to feed into some of the healthcare structures that are already there. That's going to be useful information for physicians and for patients directly. Is it the same sort of approach for your company?
Yeah, and I think the difference possibly is when these interventions happen, and
okay,
we're very much focused on preventative measures. You know, we recognize that chronic disease is a big issue, and so many of that can be prevented by shifting people's behaviors at the front end or in their day-to-day existence and practice. And so that, and then adherence. I think adherence, we know, is a behavior change challenge, and I think similarly, like branded exercises or branded experiences tend to have a positive impact on that. I mean, we acquired a company called Mirror middle of last year, which is a fitness platform, and that was very much, you know, the continuation of our expression as a company, where we have a culture that we call the sweat life. The sweat life is this sort of codification of how we make physical fitness, emotional fitness, and social fitness available initially to our employees. It's just who we are. It's the way that we live, and wanting to make that available, you know, much more within arm's reach of desire, in an ecosystem that people can bring into their homes. So Mirror is part of the extension of that, and a digital environment where content and feedback is always available, where immersion can help to shift behavior, and richness to the experience can take away some of the burden, I think, of a difficult choice, which can be, given that we're generally a lazy species.
It sounds like quite a holistic approach relative to most of the elements that I'm very aware of from the traditional healthcare industry. Does that require a rethinking of the way in which you might deliver the information that you're gathering?
I personally believe that it will require a change in how healthcare thinks about administering those points. I think, you know, I mentioned earlier, and John, you said we'd come back to it, but on brand, you know, the power of brand. You know, we follow people, or we follow brands. It's part of what does that mean? Well, I think if you think about healthcare and take the sort of as a comparison, healthcare is a means of symptoms diagnosis and prescription. You know, doctor is an extremely powerful player, and their consumer is a patient, and the patient, you know, to be taken literally means to tolerate delay, and it doesn't put that, it's not a system that's designed to put that person in the driving seat. So if we were to put the consumer at the center of the driving seat, then what we would be talking about is a brand-led experience. And brand-led, and what brand means is, you know, the codification of the experience, the consistency of a voice, you know, to change the expectation of a consumer. A consumer chooses a brand, and they adhere themselves to a brand, and they follow the brand, and they are inspired by the behaviors that brand might put on a pedestal, put onto a campaign to make available to to everyone. So I think that branded approach is an important step to shifting that dynamic of either adherence or proactive positive steps in health.
I think we're seeing a lot of that play out when you look at the conversation analysis on Twitter, and you look at the top trends by way of conversation volume. And health was huge when we looked at this the last time at the end of last year, pre-COVID. And it was all about, you know, mind-body connection. It was all about whole body health. So that transition is happening, where consumers very much feel empowered, and they are not the doctor, the prescription. That's one piece of it. But it's also about how you feel, what you eat, what you do, who you talk to, your network. People are looking at alternative therapies. People are looking at, different ways of managing their condition. And you're seeing actually traditional medicine come behind that with things like meditation and things that are additive to the prescription. So I think you're seeing this world that was very two-dimensional really open up in a very interesting way, where it's not one or the other. You know, you're not just taking the drug, or the Steve Jobs, I'm just going to eat fruit and that's going to manage my pancreatic cancer. It's not, it's both. And you're seeing that really happen when we look at the conversation on Twitter.
Lisa, is there much discussion of the sort of medical aspects of healthcare relative to the meditation, let's say?
Yeah.
Because I mean, I guess something like a prescribed medicine is something you feel, I mean, I feel as a patient, I have to take it. I don't have a debate.
Right.
There's no debate about that. There's not a lot of choice, probably,
Right.
especially, you know, within the new UK national health system. I get the cheapest drug, whatever that is.
Right.
Is this why there's less discussion? Because there's less empowerment?
I don't think there's less discussion. I think it's that it's not limited to that. And I think certainly in the US, consumers do feel like they have choices, and younger people in particular feel like they have choices. They feel like they want to be spoken to as an equal. They feel like they have a much different perspective on empowerment and on managing their health. And so you're seeing a lot of discussion around cost of healthcare, around symptoms, around all of those things. But you're also seeing all this conversation around the mind-body connection, around wellness in general, around things like meditation, alternative care, and they don't live in two separate houses. It's all together. And so you're seeing, I mean, I think it was Eli Lilly put out a piece on Good Morning America a couple years ago about a yoga pose that is very good for patients who have metastatic breast cancer. So it was their unbranded handle did it, and we did a thing on it on Twitter. But you know, this is Eli Lilly who has prescription therapies and that they want people to take. But does that mean you shouldn't do a yoga pose if it's going to ease your pain? Of course not. So I think you're seeing both of those things come together as part of managing care.
I think the science is catching up with the myth as well, and there's a lot of bad science out there. Let's not deny that.
Science around what, Tom?
Around the understanding of total health. And I think we've maybe for too long kept the brain and the body, you know, either side of this strange divide. And yet, if we think about the body as an extension of the brain and absolutely a two-way dialogue, you know, if you take, you know, the vagus nerve, 90% of the fibers are directed from body to brain. So if you consider that your body is a device in which you can use to program your brain's response, and if you think about the manifestation of pain, the manifestation of discomfort, you know, whether that's emotional or physical, you know, our understanding of how those things come together is becoming more and more complete, which means that we can start to introduce behavioral prescriptions, not just chemical prescriptions. We're all affecting the same mechanisms, underlying mechanisms, and it's just more recent breakthrough in the understanding of those mechanisms is making that more available and more trusted. So 3,000 years of evidence that meditation is useful is now being taken really seriously, which is kind of strange when you think of it like that. I think 3,000 years is a pretty trusted time frame, but because we can now understand the mechanisms with contemporary science, we can talk to our consumers in a powerful way that is without any of the baggage of history.
So are we trying to synthesize these fields, as it were, that have come from different directions, one the formal medical doctor-controlled establishment, and then in our case, for the panel that we're talking about, the technology-enabled insight into other functions that we haven't really been able to study in depth because we haven't been able to measure things properly and we haven't been able to gather the data. So is this a data clash, or is this a data synthesis?
I think it's definitely an opportunity for data synthesis. I think it's as we talk about the fact that there's now all of this evidence, it's sort of irrefutable. There's also a lot more other data out there, whether it's, electronic health records get good and bad raps depending on who you talk about, right? But there is a ton of digitized data that is probably sitting for the most part unused without a lot of real analytics or insights being applied to it. I think that goes, both for the data that's collected by the providers. We've talked a little bit about the payers themselves, whether it's public or private. There's a huge amount of data there, but then there's also a lot of data that's around the patient that really helps inform what's going on in their world, in their ecosystem, and in their environment that we know contributes to their health, their wellness, and how they experience the healthcare system. And so I think this is a really important opportunity, because this is also a place where technology can play a big role. It's a place where things like AI can certainly contribute to advancing this. And that's why I think this is also a really interesting time, because there's a lot of these different technologies coming together, converging at the same time, that can be leveraged in new ways. So that's what really excites me, I think, in
so
general.
Are you, sorry, Jennifer, are you talking about kind of making better baselines for patients, as it were? I know I'm medicalizing this in a way, but that's my upbringing, if you like. Or are we talking about rounding out the information with different types of information that can now be brought to bear? So when I say making better baselines, if we understand not only what the patient's genetics might tell us about a few things that they might be prone to, but also their living circumstances, is that the kind of color you're talking about?
Well, I think it's a little bit of both of what you said. Certainly the baselining, things like the genetic information, the other health information, the environmental information. We all know, socioeconomic factors play a big role. There's lots of things that, even if it's not necessarily specific to an individual patient, that provides a lot of contextual information and added value in support of both individual patients, but also in understanding how populations are faring from a health and a wellness perspective as well.
Lisa, if I can ask you what you think Twitter and I guess there's information gathering in some ways, or at least observation of what people are saying. How does that contribute, or does it contribute to building a better set of information? Is it's still probably soft information in a way that we don't attribute it to, you can't at this point access the medical records and the Twitter feed of a person. So
it's
how does this come together?
Yeah, it's interesting. Companies like W2O, which is a healthcare specific agency, have acquired healthcare specific analytics companies that really look at the data in aggregate and being able to put together trends. So they just put out a white paper on, since COVID, the change in HCP behavior and this spike in telemedicine and how they're sharing data differently. And Twitter really is at the center of all of that, because it's breaking down barriers.
What did they see, just to color that in?
They've seen massive increases, obviously, in telemedicine, and they're seeing that doctors that are more likely to adapt successfully to telemedicine are also more likely to be using platforms like Twitter. So I think you're seeing tech really inform doctors' practices, which I think COVID accelerated, but I think was probably already there. So that's an area I think is going to be very interesting to watch, because telemedicine isn't going anywhere. People, I think, by and large, were really happy with, I speak for myself, like every time my kid gets some random rash, now I can just go on a telemedicine visit versus spending, an hour and a half in the doctor's office. So I think there's trends like that you're seeing accelerate. I think in terms of the conversation, there's always the battle with misinformation, which Twitter's very aggressively put together policies to combat. But I think there's also people really sharing the reality of what's happening. I think you're going to see social be at the forefront of the vaccination effort across the globe, getting people to get vaccinated, think that will succeed or fail based on how it plays out in social. So I think it's a very powerful tool to be able to really get a sense of what people are talking about and how they're feeling, and really to drive changes in the social determinants of health. So I think all
even
of
at
that
this
is coming
stage,
together.
can Twitter orientate those vaccination efforts? I don't want to get into vaccination, but
Yeah,
just
I don't
briefly.
know. I think, we've put out our vaccine policy, and there's site integrity, and people are working with NGOs so that somebody that's coming on from wherever they're coming on the platform from gets the right information. This is where you can get the vaccine. I think it's still too early to tell how that's all going to play out, because your average person can't choose right now to get a vaccine. But yeah, absolutely. I mean, I think that is where you're going to see people showing videos of them getting the vaccine. I think that's where you're going to have people saying,
it's
hey,
not a question of
it's fine.
advising on strategy then.
Yeah.
It's not a question of advising the vaccine distributors on strategy.
No,
Yeah.
no. I mean, that may be happening at a higher level, but none that I'm aware of. But it's all about getting the right information into the right people in an organized fashion.
So Tom, can I come back to you on this question of integrated data? I mean, I know from when we spoke earlier that there are possibly huge data gaps that you see that either are not being gathered or that are not being distributed. What are we missing, and how would it help, and how can you help?
I mean, we're very lucky to have Magic Leap on the panel. I think the most important thing to understand about data, from my perspective, is that the experience of data, the communication of data, is the gap. We can't assume that consumers should become, or intend to become, or want to become scientists. And in fact, we know that knowledge does not equal behavior. We all know that we should work out more, love more, eat better, sleep better, eat less cake, but we don't. We don't adopt the behaviors that we all know that we should. So there's clearly an access issue, and if we can present information in a powerful, immersive way, and through the lens of just understanding the basic tenets of behavior, we know that people will do or not do things in the short term based on pleasure or pain. People will or will not do things or plan towards things in the long term based on fear or hope. So we have choice. We can choose to create an informational environment that is designed around pleasure and hope, or pain and fear, or the absence of pain and fear. And I think one of the choices that we have is how we look at the data. And I suspect that the data is there. I think you're thinking about our wonderful audience today. There's a great amount of amazing data sitting inside the insurers who are working hard to mitigate and understand risk. And at the very same time, I am positive that they're sitting on the secrets of health. And the data presented and made immersive by companies like Magic Leap that can give us access and experience of it in a completely different way, I think will allow us to choose pleasure and be hopeful, which in turn then will create behavior, and we can utilize data that way.
So what are the mechanisms for maybe freeing that data? I mean, that's a big question and terribly vague, but in terms of the way in which Lululemon would aim to build its business, do you have plans to which parts of the healthcare system do you have plans to interact with, and can you persuade? Is it a question of persuading, or is it leverage from the perspective of having brand-driven consumers on your side?
Yeah, I think we'll just create better choices, and then people will make them or not. I don't think it's about persuading or competing. I don't think it's about fixing a system or anything other than maybe a little bit of a third slice of between. If there's well-being over here and healthcare over there, then there's something in the middle which is about empowerment and access. And so from a Lululemon point of view, our job is to work hard on the positive experiential side of physically healthy, emotionally healthy, socially healthy, either the events, the content that we create, the measurements or the data that we bring back. And we will experiment, just as I hope everyone else will, where we've built a virtual reality biofeedback meditation experience, because we wanted to prove that you can meditate with your eyes open, that you can see visually
doing it now,
the scene change, and that can have a positive impact on your well-being within 5 to 7 minutes. And so it's just, we will experiment with that, and we're not going to be the leaders in any sense, other than that we will create a branded experience that we think will inspire others to also do the same.
So it's not a system 1 to system 2 shift, i.e. data-driven shift that you're talking about. It's really different aspects of system 1, the positive aspects versus negative aspects.
It's how we use the data. I think how we use the data.
So Lisa, can I ask about how Twitter is engaging with the industry at this point? And I say the industry, there are many industries in healthcare. Are there interfaces yet, or are you mainly observers at this point?
Yeah, I think Twitter's purpose is really to serve the public conversation. And so you're seeing that certainly a lot on the patient perspective. But I think where, from an industry angle, where it's really interesting is how HCPs are using Twitter. And so in this world of the virtual conference, which we're participating in right now, people look to Twitter, right, to be the crowd and the pulse of what's going on. So you follow the conference on Twitter, you really get a sense of the conversation, the dialogue, and it really is just like Twitter is the crowd for football games where people cannot go. It's really the crowd you're seeing for conferences too, which is really interesting. I think from a public health perspective, you're seeing especially you saw it a lot in the wake of COVID when last spring, the amount of information that they were able to share across country borders through Twitter was amazing. To get information that's new and quick, because Twitter is so fast. There's no other platform that really shares information so quickly. So I think how it's reinventing the HCP space is going to be really, really interesting. And I think it will continue to evolve as you look at all these trends we've talked about today, the patient empowerment, all these pieces coming together. I mean, companies like Magic Leap that are, maybe if people can see and feel it, then they're more likely to do it, right? When we talk about things like physical therapy or things of that nature. So I think when you talk about the new entrants of healthcare, you're seeing technology and whether it be a social media platform like Twitter or a company like Magic Leap or companies like Lululemon, they're really able to bring this technology into a space that before was very two-dimensional, the doctor and the patient, and now it's endless. And we're looking at different levers with healthcare. And I think all of these kinds of players are making incremental changes to the way the industry operates.
Jennifer, is that how you see Magic Leap's role, expanding that sort of experience? Does it play into a broader experience, which then enables, I guess, a different sort of interaction with the healthcare system or a different healthcare system?
Well, I think there's two things, right? I definitely think that one of the sort of very core capabilities that spatial computing brings to the table is this idea of being able to visualize things in 3D or even in just entirely new ways, and for it to be really in your space, right, in your real world, wherever you might be. So that's one thing. But I also think that, and not just with what we're doing, right? I think in general with what we're talking about here, we're also talking about the fact that that the technology is pervasive both in people's personal lives, in their professional lives, and now also in their experience of healthcare. And so it's just natural, I think, that people are going to demand that ease of use, sort of that consistency of the experience, the kind of interactions that they're used to having in normal day-to-day life gets facilitated by technology in how they're interacting with both their health and wellness. And so those are the two things that I think are really important, at least for what we're doing. But I think it's a general statement too, you know, about a lot of these new digital and technology advancements that we've been talking about here today.
So what are the next steps for Magic Leap inside healthcare?
Well,
I mean, what do you see in the relatively near future beyond what you've already described?
Yeah, you know, I think everything that I describe, whether it's you know, surgery or some of these more digital health tech type use cases, you know, we're continuing to work really closely with the partners ecosystem that's out there and helping enable them to continue to build on our platform and to make them available. And so it's really an expansion and a continued expansion and advancement of what we're doing, particularly as we continue to move also into, you know, next version product and things like that. So you'll definitely be seeing more from us as we go forward that really takes us to you know, different points in this broader spectrum of use cases in the ecosystem. I will say, you know, certainly with respect to, you know, what we've seen, you know, as a result of COVID and the sort of the rise of telehealth or the rise of people working at home, this idea of being able to communicate and collaborate in 3D, you know, across the digital spectrum is really important. It's a really important opportunity, I think, for us also to really help advance that. And so that's the other thing that I think you'll see a lot more of from us in the months to come.
So there's a general feeling that the COVID situation, which we're all somewhat discomforted by, has been nevertheless an opportunity to experiment on, you know, what the future could look like if there wasn't, I guess, some of the infrastructure that currently is in place obstructing the way forward. Is this how we should be seeing this disease, as a blessing for our technological futures?
Yeah, so it's certainly enabled us to test the waters, I think, to also understand, you know, some of the limitations, but really to zero in on those things that don't necessarily have to happen in a hospital or in a doctor's office. There's lots of things that can clearly be moved into the community or into a patient's home. And so I think that's what we've had the opportunity to experience here. And I think it's pretty hard to go back once you've gotten people to have a taste of both the convenience that it brings, but I think it ultimately means that people are going to get more engaged more readily. It's going to be easier for them to engage. So that's the other important factor here.
Tom, can I put the same sort of point to you? I mean, has this been an experience that has broadened the horizons, or at least broadened the number of people that see the world as you see it, or as Lululemon sees it?
I think the collective trauma will no doubt lead, or has already led, if not already, to introspection at a mass scale, which ultimately I think will result in, for the most part, some amazing personal responsibility and a desire to start something now. It's like you know, the most amazing New Year's resolution. We've had a period of down, of fear, of shared challenge, that generally in history of, you know, humankind, that results in massive change. So, you know, what I would put out there is it's important that we don't dwell on the challenges that we've collectively faced, but recognize that we can come together and create change. And that's what people are looking for. They're looking for now access to the best possible choices. You know, a hyper healthy attitude needs to be met with value creating choices, not hyper health concern. And so, yeah, we have an opportunity. I just think that it's important we pick the right path.
So, Lisa, I mean, I don't know if you can answer this question, but it seems to me that we've got this vision, at least within the panel, and maybe we're one of these self-reflecting bubbles, and in fact, the broader world doesn't really think that, you know, we need to go to a different healthcare system. It doesn't think that we need to adopt meditation as standard practice, or any of the other types of contributions to health, not healthcare, contribution to health, wellness, whatever, do you think this is reflected in the broader community, or only amongst a sort of tech elite, or an elite, you know,
I think
the thinking classes, as some
right.
British person would probably refer to
Right. You know, I think it's interesting that you frame it in that way. I think part of what's happened is that technologies that people who are among the thinking class, or people who are early adopters, some of those things that had already been adopted are being adopted by people lower down that list out of necessity. And they're getting this exposure to it, and then they're probably not going to give it up, to Jennifer's point. But there is a glaring access issue that has also come across with COVID, and access to care and access to technology and things of that nature. So I think it's in the middle. I definitely think it's a lot of these things have been accelerated out of that bubble into people more in the general population. But there is certainly still a large portion of the population that does not have access that needs to be addressed. And that's a whole other panel, I understand. But I do think that a lot of people are trying things they never thought they would try because they've had to. And now that they've tried it, they're like, oh, you know, if I never go to my pediatrician's office again, that's perfectly fine with me. I'm happy to do this over the phone. So I think it's going to be interesting to see, once things do return to normal, how that all shakes out.
Yeah, of course, it'll be a different normal, entirely changed from the previous normal. And maybe that's an appropriate point to end, or at least ask you for a couple of last thoughts for let's say the year ahead in the first instance, and then broader ahead if you want to spend an extra 10 seconds. Jennifer, have you got some wishes for the new year and beyond?
Yeah, I think I was really inspired by the conversation today, because I think we're definitely all on the same page. And so, for me, I think there's really a lot of promise here to leverage these different technologies and capabilities to improve care, to increase people's engagement with their own care. And I think, Lisa brought up a really great point about access. And I think that's one of the other things that we have a real opportunity to impact over the next, 12 months or so, as people do continue to use these technology tools. I think that, potentially also opens up the opportunity to, shift some of the balance where there are access issues. So
yeah,
super optimistic in general about where this takes us, and looking forward to the next conversation on this topic.
Yeah, I mean, there's a narrow issue of access within developed countries and the fairness of that. And then there's the broader issue of global access, which is quite a different thing, which I guess we're probably not addressing in a tech panel. Lisa, what would you wish for the year ahead?
I share Jennifer's optimism. I think what really strikes me, and we talked about it a little bit, is the empowerment. And I think social has driven a lot of that. You don't need to go through a publisher. You don't need to, be tremendously important to have a voice and to lead a conversation. And I think that is really going to drive a lot of players that might not have had to listen to have to listen. And I think it's going to be really interesting to see where that conversation goes as we move into post-vaccination and post-COVID, and what is that new normal. So I think it's going to be a very interesting 12 to 18 months for sure.
Sure. And Tom, finally, you're going to complete the circle of optimism?
I will absolutely complete the circle of optimism. I think if we take the principles of prospect theory and recognize that people generally work twice as hard to hold on to what they've already got than they will to create the thing that they can see in the future. The important thing of that is, when you make the future now, people will hold on to that just as hard. What we've seen in this period, and what we can look forward to in the next 12 months, is because so many businesses, so many behaviors have accelerated in a positive way, having that new behavior be something that we can all own now, no matter what access you have, will result in these positive changes that we can see. I think while we hang on to the old system and we talk about the new way, like they're either side of the present, we will not get what we want. So bringing the future that we see into this present now will create some wonderful change in the world.
Thanks, Tom. And thank you all the panelists. Thank you, Jennifer. Thank you, Lisa. And thank you, Tom, for a very illuminating discussion. I personally will probably be looking to see how our new entrants here interact with the current system and how those dynamics shift around. But that's going to be interesting in the next year too. Thank you all again. And thank you so much for listening.
Thank you.
Well, thank you. I mean, what a panel. That was incredibly insightful. And I like the idea of the circle of optimism, long may it continue. So John, Jennifer, Lisa, and Tom, thank you so much. And to everyone that's been listening and is joining us today, I hope you enjoyed the panel. I defy you not to really, but, come back at 3 o'clock when we'll be having some insights from Germany around how they're accelerating their adoption of health tech innovation. But in the meantime, look after yourselves, and I'll see you back at 3.